With the advent of an aging society, geriatric preventive medicine has gradually begun to be valued. The diseases and functions of the elderly vary greatly from person to person. So different preventive healthcare strategies must be emphasized based on the individual health status of the elderly, whether they are healthy, chronically ill, or frail. This video will briefly introduce the aspects and classification of preventive healthcare for the elderly, as well as the health issues and healthcare contents that should be paid attention to in each aspect of preventive healthcare. The definition of older people in this video refers to adults over 65 years old. Generally, in preventative medicine for the elderly, preventive healthcare measures for the elderly are divided into 5 aspects: disease prevention, frailty prevention, accident prevention, iatrogenic problem prevention, and psychosocial disease prevention. Among them, disease prevention is divided into 3 levels. The following is a more detailed introduction to the 5 aspects of preventive healthcare for the elderly and the 3 levels of disease prevention, so that viewers who have elderly people at home can observe their lifestyles in terms of diet, exercise, stress, etc., and make appropriate lifestyle adjustments and disease monitoring to improve the quality of life of the elderly at home. Before we continue, please like and subscribe. Okay, now let's continue. Here are some parts of this. A. Disease prevention is divided into 3 levels. 1. Primary prevention. Maintain a good lifestyle, including quitting smoking, getting vaccinated, maintaining an ideal weight, exercising, and eating a healthy diet. Maintain a stable schedule of intellectual activities, social activities, productive activities, and avoid head trauma, excessive sun exposure without protection, and noise. 2. Secondary prevention. Monitor blood pressure, blood sugar, blood lipids, height, weight, and pain assessment. Assess urinary incontinence. Review medication use, daily living function, and instrumental daily living function assessment. Create a safe home environment to prevent falls. Increase vigilance to avoid abuse of the elderly. Consider vision and hearing screening. Regularly perform cancer screening, abdominal aortic aneurysm examinations, osteoporosis screening, thyroid function tests, etc. If the elderly have the above symptoms, dementia, depression, gait imbalance, and other functions, should be assessed during the first visit. 3. Tertiary prevention, including treatment and exercise therapy for arthritis, good diabetes control, treatment of cardiovascular disease and heart failure, treatment of osteoporosis, etc. B. Frailty prevention. With nutrition and exercise as the main axis, maintain good nutrition and proper exercise habits to establish good disease prevention. C. Accident prevention. If the elderly have slow reaction speed, sensory impairment, dementia, etc., they need to pay more attention to maintaining the safety of the environment. Therefore, children need to stop driving at the right time or improve home safety. Tacking measures to prevent falls. D. Prevention of iatrogenic problems. Older adults often suffer from multiple diseases, see multiple doctors, and take multiple medications, resulting in a lack of integrated diagnosis and treatment. When the disease requires hospitalization, they may also suffer from delirium caused by the disease or treatment, side effects of drugs, immobility caused by hospitalization, pressure sores, nosocomial infections, etc. At this time, you can ask a geriatric medicine expert to evaluate and diagnose, assisted by care from a geriatric team. E. Prevention of psychosocial disorders. The elderly are more likely to develop depression because they face the uncertainty of losing relatives and friends, the helplessness of disability caused by illness, or the fact that after retirement, They are away from their original expertise and peer circle. Therefore, it is important to increase social contacts, develop interests or leisure activities, and feel the self-worth of being needed. In addition, you can also shift the focus of your life by raising pets, participating in volunteer services, or sharing housework. In short, tomorrow's health is based on today's actions. Suppose preventive health care for older people can be started early. It would not only reduce the burden of care for family members, but also allow older people to have a good quality of life and enjoy their silver years happily. Thank you for being with us at this time. We would appreciate it if you could provide us with your feedback so that we can learn more about the topics we can offer. Your feedback is extremely helpful for us in enhancing the overall quality of our videos. We will present more videos in the coming days.